It might be more accurate to say that Americans feel generally ambivalent about their doctors, and even the healthcare system as a whole, than to say they either trust or distrust them. There were elements of simultaneous trust and distrust throughout our research, and those of others, and confusion about whether to believe the claims of personal physicians as well as of organized health-related government entities. This ambivalence may seem like a problem, but it actually makes it easier in some ways to engage people in open dialogue about trust in science, medicine, and the healthcare industry. In this situation, it may be best to emphasize and draw out the ambivalence as part of a technique based on a concept called motivational interviewing. Motivational interviewing was first developed as a treatment for substance abuse, which leans heavily on the idea that people mired in alcoholism, drug addictions, or other addictive behaviors are actually ambivalent about their addiction. While they feel compelled to continue the behavior, they often have many negative feelings about how those addictions make them feel and what they make them do. As a result, they are always seeking a way out to some extent, but often fall short when the exit route is too difficult. Motivational interviewing positions the therapist to draw out this ambivalence and help the patient articulate deeper goals that are usually incompatible with the consequences of addiction. In the process of better articulating and recognizing ambivalence, patients are moved closer to a state of readiness to change. Motivational interviewing has been shown to be highly effective and has been applied to a broad range of other situations, including vaccine hesitancy. In the case of trust in doctors and the healthcare system, it will be especially helpful to get people to recognize that they are even ambivalent in the first place, as many may not realize this. Get them to articulate the fact that they do and want to trust their doctors, but that they are very aware of the potential corruption in the system that surrounds him or her. Getting people to more carefully examine their distrust and realize that it may be causing them more difficulty making important decisions will help them approach the concept more carefully the next time they try to work their way through a complex medical issue. Recognizing the role that distrust is playing in their decision-making is a first step toward getting people to approach these decisions with a more critical eye.